Americans, back pain is a daily fact of life, but for many people, it doesn't have to be thanks to new treatment options. Here to explain, please welcome neurosurgeon Dr. Remy Nader. Good morning.
Good morning, Deborah.
You are the president of the Texas Center for Neurosciences. Let me just go ahead and put that out there. All right. There are lots of common causes for back pain.
Absolutely. So back pain is actually a very common problem. It affects about 90% of Americans will suffer from back pain at some point in their lives.
Yeah. And our backs are made to handle certain things, but sometimes there's that pushing point that kind of pushes over the edge. Poor standing or sitting posture, which over time that can lead to an improper lifting. We've all been there. Carrying a heavy purse, briefcase, or backpack. That's why I'm like, honey, carry your own stuff, right? And exercising and sports injuries, of course.
That's true. That's true. These are just some of the few things that can cause back pain. Of course, being overweight, sitting down at a desk or working at a computer for long hours. You know, a lot of things that we do in everyday life will cause back pain.
Yeah, that wrong turn there. There's conservative management, which oftentimes doctors say, let's try the simple thing first. What is conservative management
Right, so
involve?
at first we just try to, adjust posture, change just some regular habits in daily living. For example, our sitting or standing posture. If you may, I can
he's
try.
He's staring at me the entire time. He's going, okay, so. Okay.
So obviously you want to try and stand straight and, just kind of widen the shoulders, let them drop, and then let your head, raise up, and there you go.
Okay.
There you go, up. Up and out, basically. And it's kind of hard to maintain that posture. So there's something called the Alexander technique, which is the unlearning of bad habits.
Yeah.
And this actually allows us to better ourselves and unlearn all the bad things that we have accumulated over time.
You're right, and this is what you did with me right now tells me that most of us probably don't practice good posture. Look at the audience is all sitting up now. They're like, oh, wait a minute. But we probably don't. And so
just simple things.
Yeah.
Simple things in life can actually have a tremendous impact on the health of our backs.
But let me tell you, my bad posture, especially when I'm sitting down, feels comfortable to me. So if we're not in pain doing that, how does that cause pain later on in life?
Well, unfortunately, we have those nice, cushy couches and, the lazy boy chairs and whatnot, and these are very bad for posture.
Yeah.
If you remember, traditionally, people used to sit on the floor.
Right.
If you think about traditional American
Indian,
had
to sit up straight.
They had to sit up straight with their legs crossed.
Yeah.
And they actually had much stronger backs than we do nowadays.
So you got the Victorian era, man. You had to sit up straight, and all that furniture was made to make you sit up straight.
That's right.
All right. So there are those conservative management, exercise, and physical therapy and things like that. But if those don't work, other treatment options could involve surgery. Now, there's surgery of yesterday and the surgery that you do today.
That's
so show us what people used to do.
So, traditionally surgery was, so this is a spine model. This is the back, lumbar spine. So traditionally we used to make those long incisions in the back, and we used to put big instruments like this instrument, and we used to pull the muscles apart. So it was pretty brutal surgery.
Yeah, wow.
And nowadays we can do exactly the same surgery that'll get us down to the spine with a small tube, that we slit right between the muscles, and it'll get us exactly where we need to be. And we have special instruments called minimally invasive or micro instruments that'll allow us to get down to where we need to get to treat back pain. And to treat
Let me
the
just tell you right now, I like
pain.
the size of this much more than the size of this thing right here. This is a little bit better there. And and of course what you were saying earlier about getting down in there, I just want to show that basically it's what you're going into. If you cause less scar tissue, then healing time is faster, less risk of infection and the whole bit. So
that's right, and return to work time is a lot faster, and we have people getting back to work within a week after they've had back surgery.
So that laser and robotic assisted surgery.
That's right.
So it's pretty amazing. All right, you've actually, obviously hands-on teaches you more than anything.
Oh, absolutely.
You put it all together in this book, Neurosurgery Tricks of the Trade. Now, this is not for anyone at home to do, but you actually did it for the trade, for other doctors to kind of look at and share information about what works.
That's right. So I do teach at universities about my different techniques, and some of these techniques have been developing over the past few years, and the new technologies. They're all available in this textbook, along with 5 other textbooks that I have published.
All
over the
right.
years.
Well, for more information, you can contact Dr. Nader at Texas Center for Neurosciences. The number there is 832-932-9300, 832-932-9300, or you can go to 409-833-BACK. As simple as that, 409-833-BACK. Or you can also visit them at texasneuroscience.net, so you can kind of get out of pain there. All right, thank you very much. Right. For other medical needs, you may also call Victory Healthcare at 713-285-5500. You can also log on to victory-healthcare.com. They take care of all kinds of medical issues. They have doctors that practice in that wide range of medicine. While the freeze may